okay, moving on to our first slide, what is immunity and why is it important? Immunity is the quality or state of being immune, especially a condition of being able to resist a particular disease, especially through preventing development of pathogenic microorganisms or by counteracting the effects of its products. So, what exactly are pathogenic microorganisms? These are the infectious elements that we encounter on a day-to-day basis. These are bacteria, these are viruses, these are parasites, these are fungal organisms. They exist in their environment, they exist in our bodies, and we're always trying to keep a balance, keeping them out of our bodies, or if they are in our bodies, keeping them under control so we don't ultimately get sick and suffer the consequences. We do this through both internal and external mechanisms. Internally, we have a lot of bacteria that live inside our gut, and we have a variety of protective mechanisms that keep those bacteria in our gut and prevent them from getting out of the gut into the blood. Externally, of course, we have our skin, we have our hair, we have the layers of fatty lipids on our skin that help to keep everything out, and that keeps in balance. But in general, the immune system is important to help to protect the body from these invading pathogens, but also to manage stress. We live busy lives. In our busy lives, we're constantly dealing with trying to arrange to keep, sorry, I'm just dealing with an issue with my dog. Got to scoot him out, he's doing a little barking. We're always trying to manage our stressors, like the dog that barks during your webinar. So certainly helping us to recover from illness, recover from injury, but also inside the body, our immune system is very important to clear the body of byproducts of day-to-day activities, digestion, fighting off infectious organisms. When we incur some form of damage, if we have trauma, if we're athletic and we have some kind of injury, then certainly the immune system is involved in that. Or for a pet, for example, you have a cat that's an outdoor cat and incurs some kind of scratch. The immune system is called in to try to keep the bacteria that's introduced from that scratch at bay. So of course there are different types of immunity as well. There's immunity that we are born with, and there's immunity that develops over time from either natural exposure or from getting immunized. So if you look at the right side of the page, the two areas where I think we want to focus the most are our passive or maternal immunity and our active immunity, which is from immunization. So our maternal immunity is antibody that is passed on from mother to puppy, or mother to kitten, or mother to baby for people. And our active immunity is that which comes from immunization. So passive immunity is really important because when you're born, you don't have the full capabilities to deal with all the different infectious organisms that you're going to encounter throughout your life. So during the first 8 weeks of life, approximately, we have antibodies that come from our mothers, and those antibodies wane over that period of time, and we start to develop our own antibodies around that point. With our active immunity, when we are immunized, it takes approximately 2 weeks for us to produce an adequate antibody response. So we have our different levels of immunity that helps to keep us healthy and happy on a day-to-day basis. So what is vaccinosis? This is why we're here, of course, and this might be a term that's new to some of you. In fact, it's a term that doesn't actually have a specific medical definition. In fact, it's the state of energetic imbalance and life-threatening illness which occurs after an animal or person receives an administration of an immune system stimulating substances, i.e. vaccination. So of course we want to develop an antibody response and be able to fight off infections as a result of getting a vaccination, but sometimes the imbalances that occur as we're producing these responses can cause mild to severe problems. So in doing research for this webinar, I was trying to find out, okay, what is the actual definition of vaccinosis? And there isn't a true definition. It's a term that's familiar to the general public, and those of us who are practicing in the complementary and alternative medicine field, those of us who have a holistic or homeopathic or acupuncture practice, we're familiar with this term, but the general community is becoming more familiar with it as well. So in looking at the two pictures that just popped up, these are two patients that suffer from vaccinosis. On our left, we have an older Springer Spaniel, looks very sick, lots of crusting and irritation around the eyes, not a lot of energy coming out of that dog. On the right, we have an older German Shepherd dog, looks very lethargic, looks very heavy as well. So this dog isn't one that's moving around very much on a day-to-day basis. And then there's some very obvious changes in the skin that we can see too on the hind limbs and under the belly. There's hair loss and redness. So these are patients that over time, as a result of, or in part as a result of having received regular vaccinations, which are important, of course, to prevent disease, their immune system has suffered and they've developed some chronic conditions that have affected their quality of life. So what about when your pet goes and gets a vaccine and has some kind of allergic reaction? We're all familiar with allergic reactions in our own bodies. I'm suffering from allergies right now. It's spring in Los Angeles, but sometimes after a pet gets a vaccination, it can suffer an adverse response. Those are not vaccinosis. Vaccinosis is something that happens over time. So when your pet goes and gets a vaccine and has an allergic reaction or has an allergic reaction due to something in the environment, that is called a hypersensitivity reaction. And that reaction is a very specific immune system process that can happen due to something that enters the body through the nose, the eyes, through the mouth, that causes a very specific immune system response with antibodies. So here's an example of an allergic reaction you might have seen in your pet. An insect bite. It's going to cause redness to the skin. It's going to cause inflammation. There can even be hair loss at that site. When a pet gets a vaccine, some of the common things we might see is there could be swelling or hives. We're going to get to some of those pictures in just a minute. Your pet could eat something that he or she shouldn't in the environment, either inside or outside your house, and develop an allergic type response. A very common allergic response as well is flea allergy dermatitis. We're all familiar with that, especially places where it's a little bit moister. When the environment's right, those fleas will thrive and bite your pet and cause flea allergy dermatitis. Very specific response here that we see. I see this a lot in my area of town. We have a lot of flowering trees, and they fall, and animals explore their places where they want to poop or pee, and they get bit by an insect or stung by a bee, and they develop urticaria or hives. They look like little bumps on the body. This is a common picture I've actually had to see in my practice. Dachshunds are a breed that are very prone to post-vaccine reactions. We'll get into this a little bit later. And you can develop around the face, especially with an intranasal Bordetella vaccine, a problem which is called angioedema, or swelling of tissue. And as you can see from this dachshund's cute little face, there's swelling all down the nose and the throat, and that can actually even affect breathing, and that makes it difficult for them to oxygenate and definitely merits emergency treatment. And also makes us question, is this the right dog that we want to continue to vaccinate, or we're going to take some other steps? Of course here, this is not a dog that was really, really thirsty or wanting just to see what's going on in that toilet. This is a dog that's vomiting. And we, of course, have all been here at some point. But this dog, after he had a vaccine, or this is an example of a dog after a vaccine could develop vomiting or emesis, and that's a very serious concern because that means a more serious allergic reaction is occurring called anaphylaxis, and that definitely merits emergency treatment. Very commonly after a vaccine, a pet might not feel so well. They could be lethargic, and they could even have a high body temperature. So this is an image of a pet with a cold compress on. That high body temperature is a response that we might see which could be considered somewhat normal, but at the same time it could make your pet act lethargic and feel sick. A very serious concern post-vaccine or due to some exposure to an allergen in the environment would be low blood pressure, or hypotension. And this is a cat getting blood pressure checked, and this is a very serious emergency condition meriting treatment. So, post-vaccine, a pet may show absolutely no changes. This is actually what I commonly see in my veterinary practice. I take a very specific approach to vaccination and only vaccinate very healthy animals, and I tend to not see changes afterwards. I always warn my clients about it, but it tends to minimally occur. There could be mild lethargy, another thing I warn the clients about. There could be some decreased appetite. Usually this resolves within 24 hours or so. There could be some general or vaccination site-specific soreness. So right at the place where the vaccine is given, usually in the subcutaneous space behind the right or left shoulder or over the right or left hip, there can be a little bit of soreness. So what about the practitioners who are listening? Could your patients be affected by vaccinosis? Absolutely. It's really almost impossible to say which patient is going to develop this problem, but at the same time we have to consider this in every patient that we vaccinate. So in general, we have to consider there might be those patients that we need to think about some alternatives to vaccinations. And these are the patients that are not in optimal health. And these might be younger patients that maybe are having vomiting or diarrhea because they have a gastrointestinal parasite, or an older patient that has a problem like cancer or an immune system disease. Those pets that have previously shown an adverse vaccine response, we have to think about, is giving them another vaccine the right choice for their health, or should we think about some alternatives? So for every patient, we have to take that unique approach. And this is why I'm not a fan of vaccination clinics, because very often pets go to a facility or a truck in a shopping center parking lot, and kind of regardless of the animal's state of health, they get injected with a vaccine that may or may not help their immune system. So clinical signs of vaccinosis. These are the pets that are showing signs of immunosuppression. Those are having problems fighting off infection on a day-to-day basis, and this could be upper respiratory, it could be skin, it could be digestive. Those patients that have immune-mediated diseases, also known as autoimmune diseases. This is my own dog, Cardiff. He has a disease called IMHA, or immune-mediated hemolytic anemia. He's had it 3 times in his life. It happened after he received a series of vaccines, so I take a different approach to his care, and I choose to instead do antibody titers. Pets that are having chronic dermatologic conditions, inflammation from the environment, chronic infections with bacteria or yeast, those could potentially be a sequela of having received vaccines and therefore a vaccinosis. Pets having chronic digestive tract abnormalities like inflammatory bowel disease. Why is this happening? Is it the food? Is it something they're eating otherwise? Is it their immune system not being able to handle the normal day-to-day function of the digestion as a result of abnormal response to vaccines? What about when you do those blood tests and you see that there's evidence of chronic inflammation, maybe in the liver or some mild liver damage, or even kidney values started to go up, the kidneys are not filtering their toxins? Those could potentially be correlated to vaccines having been given in the past, or vaccinosis. Or strange neurologic conditions, petit mal seizures, unusual behaviors. These all could be related to inflammation of the nervous system, potentially from vaccines. So if you should suspect that your patient is suffering from vaccinosis, it's really important that the patient, or if you're a pet parent, that your pet goes to the vet, has a physical exam, and has some baseline diagnostic testing. We should use our tools to look for problems and try to evaluate trends. So doing some serum chemistry testing to check kidney, liver, pancreatic function, electrolytes, calcium, blood proteins, etc. Urinalysis is very important, especially if there's any problem with the kidneys. We want to see how the kidneys are concentrating the urine, and also look for some specific changes that could tell us that the kidneys are otherwise not functioning properly. Complete blood cell count, or CBC, is very important, looking at the total numbers of red and white blood cells and platelets. And this is a visual, a microscopic exam, which lets us see some characteristics of the red blood cells that could give us some clues as to what's going on. Radiography, also very important. This is a lateral radiograph of a dog's whole body, looking at both the chest and the abdomen. Sometimes you discover underlying problems that could be really contributing to the bigger picture. This is a lot of times we do cancer hunts and we look for tumors in the spleen or the liver or the lungs. Or we use our tools like our ultrasound. Ultrasounding the abdomen, ultrasounding the chest, very important as part of a whole body workup, especially with a sick pet. So with vaccinosis, of course, it's an unusual condition. Are there treatments for it? And a lot of the treatments that we would use for vaccinosis are those that we might use for any pet that's potentially not feeling well. We might use fluid therapy, and this could be fluids that are intravenous or fluids that are subcutaneous, depending on the patient's needs. We might use nutraceuticals, something I use commonly in my veterinary practice. I use a lot of probiotics, vitamin B injections, omega-3 fatty acids, antioxidants, and other substances that help to get the immune system functioning a little bit better. And those are things that are often given on more of a long-term basis. If we have a patient come in and they have a fever, and maybe we suspect they have an infection, even before we know that they definitely do, we might start an antibiotic therapy. This could be intravenous or intramuscular or given orally to go home with the patient. If a patient is uncomfortable and we think they're having pain and inflammation, we might choose an anti-inflammatory drug, perhaps a non-steroidal anti-inflammatory like Rimadyl or Metacam, or possibly a steroidal drug like prednisone. Sometimes patients need that. They need a little extra help from their pred. Or alternative and complementary type therapy, something is on a daily basis in my veterinary practice. And this includes acupuncture, chiropractic, acupressure, or even homeopathy. There's actually a pretty commonly used homeopathic product called Thuya, which is used for problems like vaccinosis. So in general, we really want to think about minimizing the likelihood our patients are going to suffer from any health problem, especially those related to the vaccines that were given by the veterinarian in order to strive to prevent disease. So the way we do that is to only administer a vaccination when a pet is completely healthy. I even really think about, say I diagnose my pet as having severe periodontal disease. That's going to create an energetic drain in the body. We might want to think about first cleaning those teeth, waiting a couple weeks till everything is healed, and then giving the vaccine. We also really want to think about just vaccinating for our core diseases. Those are going to be the most life-threatening. According to the guidelines of the American Animal Hospital Association, and being in California, I also follow the UC Davis Veterinary Medical Teaching Hospital canine and feline vaccination guidelines. That's very helpful to me. Additionally, we want to think about vaccinating one at a time. Giving more than one vaccine doesn't really help the health of the animal. It's just convenient for the pet owner and for the practitioner. So we have to think about prioritizing health over convenience in these cases. And vaccinate as needed. If you have this patient that doesn't have a lifestyle that merits a particular vaccine, maybe we think about not giving that vaccine or giving it if they're going to partake in a particular lifestyle. So here's the 2011 AHA Canine Vaccination Guidelines, very helpful document, and also the Veterinary Medical Teaching Hospital Guidelines from UC Davis. So how else do we minimize the likelihood a patient is going to suffer from vaccinosis? We wait between providing vaccinations. A good solid 21 days is a really safe bet. That way we allow that 14-day period or so to go by for a proper antibody response to occur. We consider titer testing to determine what's been the previous response to vaccination. Specifically with the VaccCheck, we think about our distemper, adenovirus, and parvovirus antibody levels. Especially after we go through a puppy series of vaccinations. This is very important because a lot of times, and I experience this quite a bit in my veterinary practice, we have a patient that gets a series of vaccinations from a breeder, and then we take over as a practitioner, and how do we know that those puppies' vaccines even took? So kind of specifically looking here at the 2011 AHA Canine Vaccination Guidelines, we look to see for the canine distemper combination when it's recommended to be started, typically between ages 6 and 16 weeks. I like to start everything about 8 weeks of age because that way we are minimizing the likelihood that we're going to have a less than ideal antibody production as a result of maternal antibody interference. So we follow that protocol, we immunize the puppy every 3 weeks approximately, and then very important is at the end of the protocol we wait another 2 weeks, and then we consider doing a test like VaccCheck so that we can see what the response to distemper, adenovirus, and parvovirus has been. And if that response is low, then we consider boostering again. So a lot of people are afraid of vaccinations, and I think we need to think about vaccinating smartly, but let's not be overly afraid of them. Let's not avoid them completely, because especially diseases like parvo, distemper, rabies, these are fatal diseases that we can help to prevent. We just have to vaccinate smartly. So absolutely do not 100% avoid vaccinations for your patients. We want to think about partnering, really improving that relationship between the owner and the veterinarian so that we provide a vaccine that's going to have the best effect at the most appropriate time, when that meets the pet's lifestyle. Certainly if we have patients that are frequently going around, dogs for example, going around other dogs, those that are going to dog parks, daycare, those who maybe escape from the house a lot and get picked up and brought to some kind of shelter, those are the circumstances where there's going to be high exposure to infectious organisms, distemper, parvo, rabies of course, bordetella. We want to follow our state-governed legal requirements. It is important that we practice within the guidelines of what's put in front of us by our state-governing veterinary bodies, so follow those guidelines. So really the good news here, this is why we don't want to avoid vaccinations for our patients, is that there's a very few number of recorded vaccine adverse responses. So there was a great study in 2005 done by the journal, or that was appeared in the journal of the American Veterinary Medical Association, which revealed over 1 million canine medical records in over 350 animal hospitals. And we found some really important stats here. So in general, the canine patients that are going to be more prone to suffering from vaccine-associated adverse events, or VAAEs, are those that are smaller in body size. If you look at the chart on the left side, the higher numbers of adverse events per 10,000 dogs evaluated were determined to happen in dogs that were less than 20 pounds. We have our 5 to 10 kilogram body weight there, and the scale tends to go down with a larger body size. So we have to also think about which vaccines are a little bit more likely to cause any kind of adverse event. We have those kind of all vaccines clustered together, or just given something like a rabies vaccine alone. Giving one vaccine at a time instead of multiple agents is less likely to cause an adverse response. And again, this is more common in dogs that are of smaller body size. So who are the dogs that are most at risk? We have the dogs that are small breeds or small mixes of breeds. It turned out also that dogs that were young, from 1 to 3 years of age, and I'm not sure how to explain this one, but the neutered male dogs are a little more prone to having vaccine adverse responses. And then when multiple vaccinations were given at once, we were seeing a more prevalent adverse response. So in general, when we had an adverse vaccine reaction, it occurred to the same day that a vaccination was given. And in my practice, I've actually seen this within a couple hours. In general, the good news here is that multivalent vaccinations, which means the distemper combination of distemper, adenovirus, parvo, para-influenza, didn't necessarily correlate with more reactions. But when multiple vaccines were given at once, we were more likely to see a reaction. Just think about you're pumping the body with these immunostimulants, there could be an adverse response. So here's a kind of specific document that talks about the breeds that were involved. And in looking at the top, the dachshund, there were a pretty large number that were involved in the study. There were over 40,000. And the rate of those dachshunds having adverse response was very high. There were 122 per 10,000 dogs. That's quite a few number. Looking down, other common breeds, the Chihuahua, also very highly represented, about 76 per 10,000 dogs. And then, of course, if you look further down to where we see the Labrador Retrievers, those are probably the largest breeds, the largest group of breeds that were involved in the trial, and they had a very low response. They had about a 24% response. So which patients really are going to be the most key to having vaccines? Lifestyle is very important. We have those pets that are going to dog parks a lot and certainly are going to encounter other dogs and infectious agents. They're going to be exposed to pathogens more frequently from that nose-to-nose contact or potentially coming in contact with feces. So what can we do as practitioners to try to reduce the likelihood our patients are going to develop any kind of post-vaccination adverse response? I want to consider using something like VaxiCheck, something I use very widely in my clinical practice. My clients actually really appreciate the fact that I'm thinking a little differently about their pet's health and taking vaccination from a different approach so that we hopefully don't have any adverse responses at all. Here are the components of the kit. This is what will be sent to you. Looking at it, it looks a little strange, but it's actually very simple when it comes down to getting used to it. We're going to go a little more specifically into this in the future, but it's very simple, easy to use products. I do this myself as a solo practitioner. I don't just defer to a technician. I'm the one who's actually doing all the work here. So this provides us a lot of very beneficial information. It helps to prevent unnecessary vaccination. If we have that strong antibody response, a greater than a certain control, then we can think, okay, we can maybe hold off on giving a pet another distemper combination vaccine for a yet to be determined amount of time. It also addresses the under-vaccination issue, because we have to consider those puppies who may have received that vaccination. What was the storage of the vaccine? Who administered it? Did it actually get under the skin where we wanted to? When was it administered? Was it administered too early and there was maternal antibody interference? And I've actually had this occur in my practice where we've determined that 3 distemper vaccines given at appropriate time didn't produce an adequate response to distemper, so we're now taking the steps to give another one. The VaccCheck protocol also helps us to adhere to the principles laid out by the American Veterinary Medical Association, where they actually even have said that giving more than one vaccine at a time is not necessarily going to help our patients. So this is a great statement from Dr. Elizabeth Alton. So this should be the primary concern of all of us practitioners, the welfare of our patients. If that patient doesn't seem right or not healthy enough to receive that vaccine, then we need to think about another plan, not just giving it to them because something is supposedly due. So how does the VaccCheck help us to avoid vaccinosis? Through research, it's actually been determined that the immunity to certain vaccines, more specifically distemper and parvo, carries on for much longer than the recommended time of booster. There's actually challenge studies that were performed at the University of Wisconsin where completely immunocompetent animals that were vaccinated, 5 years had gone past since their last distemper parvo combination. They were determined their antibody levels. They were then challenged with the live agents, and they did not become sick at all. I thought that to be a very powerful study that we can share with you upon your request in the future. So by testing for antibodies, we can determine if if a sufficient response has been mounted, and then we collectively can decide should we or should we not give that vaccine. Here is kind of the key component of the VaccCheck test. This is called the immunocomb, and you'll see from the kind of the middle of the screen, it says a positive reference on top, and then hepatitis, parvovirus, and distemper sequentially going down. And the numbers 1 through 12 correspond with each individual patient. When I do this in my practice, I actually cut just one little comb tine off at a time and use that because I'm just typically testing one patient at a time, but you could test up to 12 if you have that kind of practice or you're doing this in a shelter. And this shows all the different responses that we can see. We can see that there's different strengths of the positive reference, there's different colors of the responses for hepatitis, parvo, and distemper, and this all works out specifically with a patient-specific key to determine what the semi-quantitative result of the antibody levels are for that particular patient. So you actually get a numeric value, not just a no or yes, which is really helpful as a practitioner. So some of the great things about VaccCheck is lets us evaluate the components of the distemper vaccine, not parainfluenza, just those that are considered to be the core here, the distemper, the adenovirus, and the parvovirus, and it's evaluating for the IgG antibody. So the good thing is we can see if the titer level is greater than or equal to the control, then the veterinarian and the owner can collectively decide together that we might want to wait to administer that vaccine to another time. I typically recommend if the booster is recommended to be given every 3 years, then we titer again in 3 years. If we have given our puppy vaccinations and it's a year later and we're planning on giving that booster, then that's a good time that we can titer. And if things are normal at that time, we can then titer again 3 years later. So we have to also recognize that, of course, if we have an antibody titer that's at or above that industry-accepted threshold, it doesn't 100% guarantee that the pet will be immune. Immunity is a complicated process. There's cell-mediated immunity that needs to be involved. So we have to really just make sure that we are being realistic and also not thinking that let's take this immunocompetent dog that tested positive on the antibody titer test and throw them into a pit full of parvopositive puppies. Not a smart idea for that dog. So there also are cost advantages in doing the VaccCheck over necessarily just administering the vaccine. And actually one thing I want to point out here that isn't on this slide is if you give that pet a vaccination and that pet becomes sick, the owner is going to have to pay for it, or you as the practice is going to have to pay for it if you decide to, if the owner said the vaccine that you gave my pet made him sick, I'm not paying for the treatment. So that's something that really does become an issue and also breaks that trust level between the veterinarian and the owner. So in general, there's some advantages. The VaccCheck test costs less than sending a test out to the laboratory. It just takes a very short amount of time, and 21 minutes really is pretty right. I've gotten a little more proficient at doing it, and so I've gotten my time down, and so it's a great thing that we doctors could just oversee the process, have the technician do it, and we can interpret the results. And also, instead of just determining the distemper and parvo, which is often what's done at external major laboratories, we can also determine adenovirus. There's some more time savings too, and we can get the information to the owner faster, is that when we send the blood to the external lab, it takes 3 to 5 days. And in fact, when I go to my client's house, I can do this right in their house, and then we can decide together if we're going to give that vaccine or not. And there's the advantage of using whole blood or serum. In fact, I had a very tiny dachshund patient that I could barely get any blood out of, definitely not that I was going to be able to get any serum out of, and I ran it on the whole blood and determined that this dachshund's, again, one of those breeds that's very prone to post-vaccination adverse responses, this dachshund was immunocompetent. So I did that off of the tiny, tiny sample of whole blood that I got. But typically, I actually spin the blood down and do it on the serum because I'm usually also testing for other blood chemistries. So in conclusion, we want to make sure that we're observing the guidelines put in front of us, the American Animal Hospital Association and the World Small Animal Veterinary Association, which encompasses the AVMA and also the California Veterinary Medical Teaching Hospital. We want to practice good medicine by antibody titering. And something that I had kind of pounded into my head in school is that we're always concerned about making money and things like that. If you're practicing good medicine, you are going to make money. We don't want to rely on giving large numbers of vaccines as our money-making tools. We want to actually practice good medicine by doing medical workups and promoting wellness from the standpoint of preventing otherwise preventable disease, dental disease, obesity, things like that. And practicing good medicine will earn you money, and titer testing is really part of that process. And we always think our owners are going to be driven into the practice because they get that reminder card in the mail that says the vaccines do, and that elicits fear in their lives, thinking that the pet's going to get sick if they don't get the vaccine. Use that opportunity to present the whole concept of wellness, and let's consider choosing to do a VaccCheck antibody titer test instead of giving that immunization that the pet may not even need. And that way you can actually focus on the diseases that are present in the body instead of giving a vaccine for something that the pet may never even be exposed to again or has perfectly adequate immunity. There's tons of information that you're going to be able to find on the vaccicheck.com website. There's helpful webinars. There's helpful instructions on how to interpret the results of your immunocomb. I highly suggest going there and becoming more familiar with the product. And now it's time for our questions. So I welcome questions from all of our attendees.
Okay, Patrick. First and foremost, I just want to let everybody know, thank you for being here. If you have additional questions and things like that, there are a lot of great resources on vaccicheck.com. It's vaccicheck.com. I'm having a couple of issues with the question section. So if you guys could be so kind as to use the chat box just to kind of correspond with us that way, we've just got a couple of minutes here left, but we will do our best to try to address a couple of these. Kate had a question as far as the best way to bring it up to my vet. In my experience, we do have a handout on vaccicheck.com. A lot of the vets that I talk to who are their pet parents have given us their information. The veterinarians are concerned about a new technology. They want to make sure that they understand the science and the technology behind what we're doing, and that this is a viable test, and that we've done our due diligence to really make sure that this is going to, if we're not going to vaccinate, that the animal is still going to be protected. Patrick, from your vantage point, how have pet parents brought it up in the past, or how, from a practitioner standpoint, how do you feel like pet parents can bring this subject up?
Sure. Well, I think That is a really good question. We have to think about how do we know that this is in fact how do we know that the vaccines that we're given are creating the desired response? And that's where the testing comes in to determine what is the antibody level, but then also we have to consider what's the likelihood this pet is going to be exposed to a large volume of virus in the future, and that's going to or bacteria. In this case, we're talking about our viruses, but in those certain situations where the pets are going to go, a shelter, a dog park, a daycare, that's most likely they're going to be exposed to any kind of concentration of infectious organisms. So making sure that when they're going to those places, all the other dogs have either been vaccinated or those dogs have had antibody titers. And I think the best thing, if I'm not answering the question completely clearly, is focusing on the fact that the research that's been done has shown that the immunity level is conferred for a much longer time than even the recommended booster, for upwards of 5 years, and that's very clear in the AHA guidelines that distemper combination vaccine provides immunity for 5 years or more. So we're actually, in general, recommending boostering a little bit more frequently than really what's needed. And the studies that were done at University of Wisconsin very clearly show that those pets that had been vaccinated 5 years or more still had adequate antibody levels, and then were challenged with the live organism and were perfectly able to fight off the disease, and none of them became sick. So I think we have to really use that information to show that the research has proven that immunity lasts for a lot longer. And although immunity is a complicated process, having a sufficient antibody level correlates with, for the most part, being able to fight off active challenges.
Great, thank you. I see that Gina and James have both asked questions. I'm having a problem with the question section, but there is a chat box in the bottom that I've sent you both private messages. If you can just follow up with me that way here in the next minute or two, then I'd be happy to answer the questions. And I also just want to take a quick second and thank Evelyn for her recommendation on future topics as far as shelter and rescue organizations. As you can well imagine, VaxiCheck is used not only during disease outbreak, but some of the more progressive shelters, the ones that have some funding, are also using it as part of the intake process. It allows them to fast track the animals and adopt them, within a day or two, rather than having to vaccinate them and quarantine them and observe them for several weeks. They've found that this is a very viable option from that perspective as well. Let me just scroll down here and see. I don't have any feedback from them necessarily. Okay. So it looks like Jan asked, is there a feline version of this kit available? We are awaiting the final USDA approval on this as we speak, and it will be for panleukopenia at this time. So we're eagerly anticipating that, and we will let you all know and have a big push for it on vaccicheck.com, because we know there's a great need there from the feline side. Another question that I get frequently on the VaxiCheck Facebook page is how my vet hasn't heard about this. And obviously, we talked a little bit about Katie's way of bringing it up to your vet. Stick with us, because this is a great product, and we haven't been on the market for a real long time. And so we are working with really the first adapters in veterinary medicine to get this product out there. There are a lot of there's a lot of academia behind this product, and more practicing veterinarians that are utilizing this technology, both for over vaccination concerns. But here in Arizona, where we're based, we're also, as Patrick mentioned before, utilizing it for the puppy protocol. We're utilizing it for the puppy protocol to ensure that the puppies are in fact producing protective antibodies, and that they are in fact protected after the initial vaccination series. Patrick, do you have anything to add to that?
I think that's a really good strategy, and that's the strategy that I've been taking with my patients, because there is that question of those vaccines that were given before, how were they stored? Were they given correctly? Is this just one of those pets that is incapable of actually producing a sufficient antibody response? Those patients do exist both in animals and people. There's some kind of defect in the immune system, and yes, you get that piece of paper from the breeder that says, yes, my dog was vaccinated for 3 distempers, but what if something failed in the process of having them produce immunity? And then you push them out into a normal day-to-day life of going to dog parks and daycare, and your pet gets sick with one of these potentially fatal diseases. That's not something any owner would want. And so I actually suggest all owners do that testing as soon as they get their puppy to make sure that the actual antibody response has been produced. It's really worth the peace of mind, depending on what your vet charges you for it. It's certainly something that I would want to know that I was adequately protected, that my dog was protected before I thrust him or her into the realms of potentially being exposed to a bunch of different potentially fatal infectious diseases.
Okay. James had a question as far as doing dogs due for a rabies booster. We don't necessarily have a protocol on that because, obviously rabies are mandated by and required by the state. There are a couple of areas that are that will accept titers for rabies, but it's really mandated by the state. I know, Patrick, you live in an area that allows for rabies titers, correct?
For sick animals, yes. If a pet has if the pet is under the care of a veterinarian and has previously received a rabies vaccine, then the veterinarian can exempt the pet from further rabies vaccination in order to still be registered with the state. This isn't necessarily a well pet thing, it's a sick pet thing. And interestingly, they don't actually ask you to prove the antibody level. They just want to know that the rabies vaccination was given. So I think it would be better to actually know what the rabies antibody levels was, which is done through routine blood testing. For example, if your pet is traveling to the UK or Australia or Hawaii, you have to do antibody testing before the traveling. It's one of the legal requirements. And when we get that result that says that the pet has produced an adequate response, then that's generally accepted that the pet is not going to develop the disease if it's exposed to it. So I really think we have to apply that to the other agents as well.
Okay. One question that I had, one of the ladies, and I'm trying to find it on our Facebook page on VaxiCheck, one of the ladies was confused about the numeric value. She was under the impression that, um, if she was using, I think, Antec or IDEX to send out the test, and it came back with a protected or unprotected result. Patrick, from your perspective, what do you feel like the value is for VaxiCheck because it gives you a semi-quantitative test score and lets you know, gives you a better understanding of how much titer is present?
Right. I certainly would want to know if my pet, as a result of having been previously vaccinated, has produced a very strong positive response, a average response, or an unquantitative response, or a response that is below the acceptable level. So in that case, we can then, and actually, we have to think about this, even when a pet has produced antibodies, if they are below the level, it's still likely that they'll be able to mount a sufficient immune response. This is just a general industry accepted level in terms of where we want to kind of shoot for, but just because you're a little bit low doesn't mean that you're suddenly going to be susceptible to the disease. So in those cases, the vet and the owner can decide, do we want to booster or do we want to maybe test again in 2 weeks and see if the value changes or something like that. Depends on when the vaccine was given. So I think that we have to really look at knowing how strong the response is very important. And if it is less than the desired response, then we consider a plan to address the issue. I would personally rather know my dog's response is very, very strong versus just strong. That would make me feel better that they would be more likely to mount off an active infection.
Great. Thank you so much. We are going to wrap up today. Again, I would encourage you, if you want to find out more about Spectrum Labs, please go to our website at www.wearespectrum.com, or you can find more information about VaxiCheck at vaxicheck.com. The other thing is that if you are a licensed veterinarian and on the call with us today, we'd love for you to start interacting with this product and are offering a $50 discount off of the cost of the test of the kit. And for you pet parents, I know it seems like an uphill battle. However, if we can get your veterinarian to utilize it and let us know that you were on the webinar today. Same with the veterinarians. If you notice or let the girls in customer service know that you were on the webinar today, we can extend that to your veterinarian as well. I know we didn't talk pricing specifically, and that is by design. Every veterinarian does set their own pricing, but we do want to work with as many of the pet parents as possible and try to get this product out there. Patrick, we thank you so much for your time.
Absolutely.
And look forward to speaking with you about other products or other topics that are related to VaxiCheck as well. And thank you very much. Have a great day.